But yes, I'm Rick Resendez. This is my daughter, Bruna. And Bruna was born with a severe myopia. So whenever she would, as a little girl, my wife, Angelita, who's sitting right there, would walk her. Is it getting too loud now? Would walk. They'd take walks, and whenever she was walking with her, she would, frequently fall, and she didn't understand why that was. So, but as the years passed, it finally got to a point, because it got worse and worse, that she had to take her to the doctor. So as a very, very young little girl, 2 years old, 2 or 3 years old, she had to start wearing glasses, and not thin, light glasses, but very, very thick glasses. Well, that developed and got worse and worse as the years passed. And then when Angelita and Bruna, Angelita asked me about 2 years ago, can you please start looking for doctors that will help Bruna? Well, that was a tall order, because we didn't want to tell Bruna what we were doing. And so I had to go to her doctor, to her eye doctor, in order to get her a prescription, and start making phone calls to different doctors in order to have them consider seeing her. And over about a year, maybe about a 6 month, a year time period, I contacted physicians, but nobody here in Nashville could do it. I won't name the names, because that's not fair, of the clinics that I called. But there was a physician in New York, and one in Boston, one in Los Angeles, that could do it. But once again, you make the trip all the way out there, and then you have to stay in a hotel, and then you have to wait for the surgery, and then you have to come back, and then you have to go again, and I started adding it up, and it was beyond our means. So we waited a little while, and Angelita said, just wait. Let's see what. No, she said, wait, let's see, because her age was still an issue. In order to do this, a lot of the doctors here in Nashville, even if they could do it, they would not do it at her age. She had to be 18 or older. So the liability, the issues involved, she had to be able to sign along with us for the procedure. So it got very, it got legal at that point. And so we held off a little while longer, and finally we were getting ready for Bruna to graduate from school, and she wanted to go to the university. I get a little sentimental about this. She was getting ready to go to university, so Angelita said, please try one more time. So I went through the process of calling all of these doctors all over again. And there was one who was actually kind enough to tell me at one of the clinics, one of the very, very most popular and famous clinics here in Nashville, who told me that he couldn't do it, he couldn't even touch her, but that I should call Dr. Wang. I thought, well, I've heard of this guy, but didn't know that he would actually be willing to do it. Well, about a month later, I ran into a fellow in my coffee. I work for a healthcare company, and in the coffee room, I ran into this fellow who said he was just having his eyes done by Dr. Wang. And I thought, so my ears perked up, and I said, "What? Tell me about that." And so he started telling me about what had happened to him. And he said, "My eyesight's perfect." Well, oh yeah, and that was when I started calling to find out about this, and spoke with Dr. Wang, spoke with Miss Suzanne and the other people here, and we arranged for an appointment, and we brought her in. And Well, I tell you, that from that point forward, it was great. But even then, it wasn't easy because, you know, we came in, they did the exam. It was a very, very thorough exam. But even then, they had questions. Are you committed? You know, can you take not only the financial commitment, but the time to, you know, go back and forth from we live in Spring Hill, but bring her, do the work, and then have the surgeries, and then go through the treatments, and you know, and even this trip that we're doing today. So you know, it takes some doing, but you know, they were all gung ho to do it. I was the one that said to Angelita, "Hey, she only has 2 eyes. That's it." And boy, I don't know how I'd feel if her eyes were affected. So that was hard for me to do. It really was, as a father. But we, Angelita agreed. Angelita agreed, and so we did it. And Bruna, boy, she was just gung ho. You know, let's go, let's do it. I'm ready, and let's start. But we okayed. We signed all the authorizations, and then Bruna started the process. And boy, I tell you, it's been wonderful, wonderful. And I guess I would do it again, all over again, and so would Angelita. So anyway, I'm going to pass it to Bruna. She doesn't get as sentimental as I do, but here she is. Thank you.
Hi, everyone. I'm just here to tell you that if you're worried and if you're scared, don't be, because nobody was more scared than me and my parents. And at first, everybody already said that a lot of doctors said that they couldn't do anything for me and that I was too young. But then, you know, I talked to Dr. Wang, and I did some research on like what we were going to do, because I was going to do told me he could do implantable contact lens for me, and then I'd wait for it to heal, and then do LASIK. And we were scared, but then we decided, you know, let's just do it. And oh, it was wonderful. My eyes healed super fast. Like it was like I went home, and then 2 days, and it was like, oh my gosh, it's not even like I did anything. And it was, I'm so thankful. I'm so thankful to Dr. Wang, and I'm so thankful to God, and I'm so thankful to my parents, because I see better than I ever saw before, everything. So don't be scared. You're in very, very good hands, in the best doctor there is.